You're about to listen to a Sports Medicine Weekly Ask the Doctor segment, where Dr. Brian Cole provides his analysis of an orthopedic condition or treatment in just 5 minutes or less. Ask the Doctor is presented by Vericel. Vericel develops, manufactures, and markets autologous cell-based therapies for patients with serious disease and conditions. For more information about their products, visit www.vcel.com. That's VCEL.com.
You have a diagnosis of a meniscal tear. Fortunately, there's no significant evidence of underlying arthritis, and it appears to be an isolated diagnosis of a torn meniscus. There are several ways meniscal tears can happen. Most commonly, it occurs over time as we age and the meniscal tissue degenerates. If you've had an acute or sudden event and you're relatively young, that tear may be new. The larger the tear, the more likely it is that you will need surgery to correct the problem. Small meniscal tears with minimal symptoms, whether they're long-standing or of new onset, can be treated without surgery. There is no significant data that shows that with a diagnosis of a meniscal tear, that your participation in activities will make that meniscal tear worse. Small tears with minimal symptoms can be safely neglected, and I'll encourage you to participate in activities. If, however, you have significant pain, surgery might be an option. Acute tears or very large tears might require surgery more frequently. Long-standing tears, as determined by your history and your MRI findings, might actually do well with a cortisone injection and what we call skillful neglect, maybe physical therapy, anti-inflammatories. If you require surgery for your meniscal tear, and it's a large tear, we might recommend repairing it. Meniscal repairs typically involve an arthroscopic procedure where we repair the tissue back to the periphery or the capsule where it tore away from. Those are most commonly known as bucket handle tears or very large tears. Sometimes meniscal tears can occur at the insertion of the meniscus called the meniscal root. Those too can also be repaired. It's important to understand that if we recommend a meniscal repair, that it can require a timing of return to sport that approaches 4 months or more. It is also important to understand that patients who have a meniscal repair can have a re-tear depending on their sports and activity levels that occurs 1 to 2 times out of 5 in all meniscal repairs. Alternatively, your tear may not be amenable to repair. It might require removal of a flap or a significant portion of the meniscus. Patients often have concern that if you remove my meniscus, I will develop arthritis later on because you remove my meniscus. An interesting point is that once your meniscus is torn, it's not likely functioning normally. So living with a meniscal tear, for example, is no different than having the painful tear removed in terms of the long-standing natural history of your knee. In other words, if you have a tear in your meniscus, it's probably not functioning normally now. If I indicate you for surgery to remove the meniscus, it is not likely your knee will be any worse off than if you left that tear alone. But the purpose of the surgery is to eliminate your pain. Taking care of a painful torn meniscus by trimming it is very effective in most instances in achieving a successful outcome of less pain and more function. Your knee should be no worse off after that meniscus is removed. However, if it's repairable, we will go through every effort to try to repair that meniscus because that might protect your knee downstream from the natural history that might include the development of arthritis 10 years or more down the road.
If you enjoyed this episode, don't forget to subscribe to the Sports Medicine Weekly podcast. We're available on Apple Podcasts, Spotify, or wherever you listen to podcasts. For more details and content, visit sportsmedicineweekly.com.